Soap note for this week. Mr. J.H. is a 75-year-old male with the chief complaint of abdominal pain. Per patient, the pain has subsided since it started last week, but the pain only comes when he eats something or drinks something. Past medical history is a little extensive, alternating exotropia, constipation, chronic periodontitis, chronic major depressive disorder, focal motor seizure, spinal stenosis of lumbar region, malignant tumor of the kidney parenchyma, BPH, dystrophia, Hep C, carcinoma of prostate, basal cell carcinoma of the upper extremity, insulin treated type 2 diabetes, neck pain, arthritis, hypertension, GERD, hyperlipidemia, allergies to penicillin, crab, lisinopril. For a review of systems, general denies chills or loss of appetite. Respiratory denies shortness of breath or denies difficulty breathing or pain with inhalation or exhalation. CV denies chest pain and denies radiating pain. GI denies abdominal pain, nausea, vomiting, diarrhea. And neuro denies headache, numbness or tingling, and psych, no changes in mood or behavior. So, Miss Gagnon didn't want to do any vitals. They're not really routinely done on, so when we submitted everything, she didn't say that they wasn't required, but the vitals from the day before, I did look at the trends and they were normal. There was nothing, there was, his vitals were trending at his baseline. General. So JH is an elderly man not showing any acute signs of distress upon entering patient's room. Patient seen laying in bed with pillow covering his eyes or over his eyes resting. Drinking water. Sorry, I feel like I need to sneeze again. Drinking water without difficulty. No guarding of the abdomen. Respiratory. His lungs were clear to auscultation. Bilateral sounds. No rales, bronchi, wheezing or cough. CV, heart sounds noted, S1, S2 present, apical pulse was within normal limits, and no murmurs present. GI, no abdominal distension, soft, tender, flat, bowel sounds present in all four quadrants, and neuro was baseline for patient, no changes in baseline, upper or lower strength. Integumentary, we did notice that redness to his left pedal first digit, with purulent exudate oozing from around the nail bed. The sacrum was checked. This patient he can move if he wants to, but more so chooses not to. He was kind of like forced to move into the VA a couple of years ago by his wife. He's a pretty big guy, so I wanted to check his skin as well because he doesn't move around so much. So sacrum was checked, and redness was noted, but it was blanchable. And psychiatric, he's baseline for per patient. Medications, he's on quite a bunch of them, obviously sliding scale for his insulin, Tylenol, aspirin, so forth. Other medications for his diabetes. But assessment and planning. So abdominal pain, discomfort. Now the pain has improved, but still has discomfort when eating and drinking. So no pain currently. Sorry. I'm really sorry. I don't know. I think my allergies are really bad. So he was started on omeprazole from last week, and he's continuing that as ordered and Maalox as needed. Educated the patient with refraining from drinking and eating acidic foods such as tomato juice. He did tell me that he really likes drinking his tomato juice. So I said until the pain subsides completely, and give it a couple more days, at least while he's on the medication, to stop from eating anything spicy or with a lot of flavor, especially like the tomato and orange juice. And then regarding the first digit on the left toe, we reached out to podiatry for consult regarding the left pedal first digit for the purulent exudate around the nail bed, and educated on turning the patient turning self in bed because the patient is able to. So I said, while you're watching TV and throughout the day, to prevent irritation to the skin, you don't want to have that moisture accumulate. So to just move yourself every now and then while watching TV in between commercials. And that is the soap note for this patient, Mr. JH, for this week. Thank you.